I'm Dr. Syed Abutalib. I'm the director of the Hematology and Bone Marrow Transplant Unit at Cancer Treatment Centers of America. High-risk features are common among patients with CLL. In one study of 1,214 patients, more than 60% were found to have a high-risk features at diagnosis. Chemoimmunotherapy has shown limited efficacy in treating high-risk patients. At diagnosis, NCCN guidelines recommend testing for certain genetic aberrations to inform prognosis and/or therapy determination. So in my practice, a patient who requires treatment with CLL, we routinely perform conventional cytogenetics to look for complex karyotype, and also do FISH studies specifically looking for deletion 17p. The FISH study usually also report the results of trisomy 12, deletion 11q and deletion 13q. And in cases where 17p is not evident or is absent on FISH study, we typically use the TP53 sequencing test. Equally important is to do molecular analysis to detect IGHV mutation status. Most patients with CLL have a high-risk cytogenetic features and likely require a targeted treatment. In a patient who has high-risk cytogenetics at diagnosis or at relapse, it is important to understand what is the consequences of that genetic aberration. For instance, if a patient has a TP53 mutation or 17p deletion, or they have IGHV unmutated CLL, it is important that patient understands that the chemoimmunotherapy is not the right option and the best to do targeted therapy. And for most of our patients, we use BTK inhibitors in that setting. So it's extremely important to check all patients with CLL for cytogenetics and with FISH studies, specifically for 17p, because these cytogenetic abnormalities have relevance to the treatment and the treatment outcomes. The NCCN guidelines recommend BTK inhibitors and other targeted therapies as the preferred regimen for patients with high-risk features such as 17p deletion and/or TP53 mutation. So as we advance in the area of CLL with the better and better therapies and hopefully one day cure, it is important to realize that the risk stratification parameters would change with time, and which is a good thing, and this is because of that new targeted therapies are emerging as we speak, and one of them that has really changed the landscape of CLL is the BTK inhibitors. Thanks for watching.